Floor to Mr. Bilirakis for 5 minutes.
Thank you, Madam Chair. I appreciate it. Thank you for allowing me to sit in on the hearing. I'm not on this subcommittee, so I really appreciate it. And I want to thank the panel, too. I'm from the state of Florida, so obviously we've been affected by the Zika virus. So I appreciate all your assistance. I have a few questions. Dr. Persons, could you discuss how we can best streamline agency coordination to prevent bureaucratic overlap and redundancies, which can lead to waste and unnecessary delays and hamper the effectiveness of response?
Thanks, Mr. Bilirakis. So appreciate the question.
Sure.
I'll answer it in two ways. One is GAO has a standard a manual for internal controls, and it's called the Green Book. And so just the efficacious implementation of those internal control standards, which primarily often have to do with interdepartmental communication and things, which often is at the core of this. As you know, all the agencies here have they're doing very important work, very important roles and things, but that systematic look at something and being able to coordinate is easy to say but harder to do, and yet very important and critical to a timely response. The second answer, I would say, is related to just our overall work. GAO, as you may know, does work on overlap and duplication, and so we have a standing methodology on looking at what constitutes overlap, duplication, or even fragmentation among federal programs. That report just went out recently, and there's methodology behind the thinking on that might be commendable to this conversation.
Thank you. Next question for Dr. Bright. With a coordinated interagency response, are there interagency goals that drive response and preparedness strategies? If so, what are those goals?
Our goals, so our Assistant Secretary coordinates all of our research efforts and response efforts to the Zika response and other public health emergencies. And so we established early on in the outbreak an awareness of the Zika outbreak that we would have interagency alignment in vaccine production and diagnostic production and other countermeasure development. And we established and drafted HHS-wide, U.S. government-wide goals to achieve the milestones for those vaccines and diagnostics.
Thank you. Dr. Peterson, CDC established a Zika registry last year. What data is captured in this registry? How is this data being utilized?
So we gather data on evaluations that are done on the mother and fetus throughout pregnancy, but importantly also on the condition of the fetus and medical consequences of infection following birth. We hope to continue this work and to follow these infants born to mothers infected during pregnancy to determine what the full impact of the virus infection in the mother actually is on the fetus. And that's still an open question.
Okay, what's the value to researchers of tracking beyond 1 year or tracking 5 years? What are the benefits to that?
Well, I think the benefits are primarily is, for one, telling people what to expect. Two is to provide appropriate medical care and social services for those infants in this condition.
So you would recommend tracking 5 years as opposed to just 1?
Recommend excuse me?
Yes, you would recommend the 5 years.
I think we need to follow these infants up for, probably 5 years or possibly even longer.
Even longer.
What we find.
Very good. Thank you very much. Good information. Dr. Parsons, earlier this year, the administration released a brief budget outline that proposed a coordination point for Zika-related activity. Can you share observations on how such a central coordinating point could help?
So yes, thank you for the question. I think this, again, this incidence with Zika is, as an emerging infectious disease, is one of a kind, and it's unique in one way, but we've seen pattern before, and so I think as you shift more toward a stronger central coordinating factor, I would say, for example, there's the importance Dr. Fauci mentioned earlier on ASPR, and that within or interdepartmental coordination with HHS is certainly critical. There's also a sort of a whole of government thing that I think was on display when the previous administration had appointed a Ebola czar back during the Ebola timeframe, just because there are oftentimes things, even outside of big HHS and all the important work they're doing, There's often whole-of-government response that may involve, for example, DOD, or in this case with mosquito-borne vector disease, you're talking about the regulator of pesticides, EPA, or various other things. So I think there's some potential commendable thinking on what that central function coordinating might look like, even in a whole-of-government sense, on something this complex and this rapidly evolving.
Okay, I want to thank all of you for your efforts, and I look forward to working with you. We can combat this virus, so I really appreciate the testimony. And I yield back, Madam Chairman. Thank you.
Thank you to our colleague from Florida. And to close out,